The government says pharmacies need to buy tests from the GHA for quality assurance. It says that £5.40 is the cost price of the tests they have. We asked why the GHA was buying such expensive tests, given that other tests approved by UK regulatory bodies appear to be available at a much lower cost. The government claims the product the GHA is procuring meets Gibraltar's requirements for testing in order to protect the community. It told us that these meet the mandated specificity and sensitivity requirements for the community and that freight charges also add to the costs. It says the GHA purchases LFTs in bulk, which are exported from the UK. Meanwhile, across the border, the Spanish government has recently capped the price of lateral flow tests at €2.94 for over-the-counter purchases. In the UK, the public can order them online for free. These are subsidised and are at-home tests, which are not permitted on the ROC due to the preferred model of supervised testing. The Director of Public Health, Dr. Helen Carter, told GBC this was because of the quality of the tests, testing technique, linking into the lab and contact tracing, and insights into epidemiology.
Never been a fan of doing the test at home, frankly, to tell you the truth. And the test that I've had to do if I've flown to UK and I've had to do it at an hotel or somebody's home or whatever, I don't know if I'm doing it properly.
You can order on the NHS hotline on the internet and get a free box of 7. Well, that's just knowing that, a peace of mind really, knowing that you're not passing it on to anybody.
Of the 16 pharmacies listed in the Yellow Pages, just 2 are offering the service at the moment. Some are still weighing it up. Many have opted not to offer the service given the high cost price, strain on their resources and the fact that the airport facility already offers it. Some were unclear on the process of applying for a permit. Pharmacies that are offering in-house lateral flow testing, in line with current regulations, are doing so at a price of £15 to £20.
We are bringing this service to our pharmacy for the simple reason that in today's lifestyle we need it for everything, whether it's for school, for work.
For us it's a logistical issue. It's hard to get people in and out, and we'd have to come across patients who are there who maybe are vulnerable or patients, and I don't think it's a good idea to get people mixing people. I think government offers now a service which is probably perfect. It's accessible, either here at Midtown or even at the airport. So it's something that we don't see ourselves doing at the moment. It's not something that we think we should be doing.
I'm very happy we can help the community out. I strongly believe that these tests need to be widely available for the community. I know it's not what some people might want, but it's definitely a step in the right direction. It's mainly, it definitely is asymptomatic patients who just want to have a test before they come into contact with a vulnerable relative or friend, or unvaccinated people that might need a certificate of a negative test.
The service entails them coming over, us taking them to our clinic, having their swab test done. They will be receiving a text or a certificate with their results, and they will get the one-to-one service.
People with symptoms cannot use these pharmacy services. These tests are mainly for people who want peace of mind, as the government only accepts arrival tests done by the service at the airport. Those are priced at £30 and £25 for GHA cardholders. On why people are directed to the test centre at the airport, the government told GBC that a tender was put out for one in late 2020. And of 5 applications, the successful one is now running the airport testing facility, Maritime Medical Services. Despite being a private company, it's considered the government's official travel testing centre, following its success in the tender process. It's not uncommon for governments to direct travellers to a private test centre for COVID tests. In the UK, they do the same, with almost 100 suppliers listed. On the cost of getting a lateral flow test from the government's official travel facility, it said that this tenderer offered the best value for money for the taxpayer with supporting infrastructure. Government adds that it has been keen to ensure pricing is kept as low as possible. By way of comparison, in the UK, Boots charges £20 for a lateral flow testing service in store. Heathrow Airport charges £25. In allowing pharmacies to offer lateral flow tests, Public Health has made them more widely available. However, for as long as these need to be supervised, this will be reflected in their cost.